and the different agencies that give give the accreditation. And after that, the last two lectures, we will pass it on to Jaldeep, and he will be doing skills and effective communication. All right. So that will end our cycle 6. Okay. Any questions? And these are interesting lectures, so please see to it that you do make time to attend. All right. So this is part 2 of last Friday's lecture on urines, and it's interesting because it's dealing with a little bit of the automated parts which is available today. All right. So let's start again. All right. Physical and chemical examination of urines, and we're going to take the help of machines for this. So we said an introduction is a body fluid that has been examined by physicians for centuries, and we know that urine is the ultrafiltrate of blood. Consider a mirror image of what happens in the body. And it's true because especially in the West, urines are done routinely. In fact, when we were students in the US, if a patient was admitted, every 5th day his urine was examined. Because the doctors felt that if something was wrong with the urine, something could be wrong with the patient. So urine has a long, rich history as a source of measuring health and well-being, and remains an important tool for clinical diagnosis. The clinical information obtained from a urine specimen is dependent on the urine collection method, timing, etc. involved in the collection and handling of the urine. Many collection and transport containers for urine specimens are available. Determining which urine collection method and container should be used depends on the type of laboratory test that is ordered. All right. So here we have a little bit of history, and you can see that the urine was examined many years back. Something that was crude, something to what was a little bit fancy. So let's look at the different types of urine collection methods employed when and where and how. Randomly collect specimens are not regarded as specimens of choice because of the potential of dilution of the specimen when collection occurs soon after the patient has consumed fluids. Then you have the first morning specimen of choice, that is the specimen of choice for urinalysis and microscopic analysis, since the urine is generally more concentrated. Midstream clean catch specimens are strongly recommended for microbiological culture and antibiotic susceptibility testing because of the reduced incidence of cellular and microbial contamination. So the first morning is always preferred. We tell the patients, as soon as you get up, clean the area and collect. We give them the container. And of course, you've got the midstream clean catch. As the name says, again the area is clean and some parts of urine are allowed to flow through, and the midstream is stored in a sterile container. So we continue. The time collection specimens may be required for quantitative measurement of certain analytes, including those subsets of diurnal variation. Analytes commonly tested using time collection include creatinine, urea, potassium, sodium, uric acid, cortisol, calcium, citrate, amino acid, catecholamines, methamphetamines, vinylmandelic acid, 5-hydroxyindoacetic acid, proteins, oxalates, copper, 17 ketosteroids, and 17 hydroxysteroids. So there's a long list. Collection from catheters, example Foley's catheter, using a syringe followed by transfer to a specimen tube or cup. So a syringe is inserted at the end. If the end is clean, a little bit of urine is taken out, maybe discarded, and then a little more is inserted into a sterile cup. Alternately, urines can be drawn directly from the catheter to an evacuated tube using an approximate adapter. So here we have a urine container and the test that may be. Somebody please switch off the volume. There's a lot of disturbance coming from somewhere. Alright, so here we go. You've got the urine container and depending on what tests are ordered on the urine. Then you've got the suprapubic aspiration, may be necessary when the non-ambulatory patient cannot be catheterized or when there are concerns about obtaining a sterile specimen by conventional means. So this is done by the doctor behind the X-ray or in front of the X-ray, where a syringe is inserted into the suprapubic area and a little bit of urine is drawn directly from the area. So it has to be the bladder. Pediatric specimens present many challenges. For infants and small children, a special urine collection bag can be adhered to the skin surrounding the urethral area. So the little container has a little bit of sticking material, and the container, that little bag is attached onto the child's urinary tract area, and the child is allowed to move around, and whenever it feels like whatever urine it voids, it will void into that container, which is gently removed and examined. You've got urine collection devices. There are cups with snap-on lids, leak-proof necessity. That's if you have to transport the urine. Urine collection containers for 24-hour collection, especially for tests when you're doing GFR, etc. Capacity to hold 3 liters minimum. Urine specimen tubes. Urine specimens may be poured directly into tubes which screw on or snap on. Additionally, evacuated tubes similar to those used in blood collection can also be used. So there are lots and lots of devices available to collect sterile specimens of urine whenever needed. Urine specimen collection and transport guidelines. So sometimes urine has to be transported from one place to another. As for any type of clinical laboratory specimen, certain criteria for collection and transportation of urine specimens may be met to ensure high quality specimens, free of pre-analytical artifacts, are obtained consistently. Without this, accurate test results cannot be performed. So you've got the various containers available here. You've also got the tapered ends, which can go straight into the centrifuge once the dip trick is done. Depends on the person. So you've got urine specimen preservation. So we said what donors should wash hands before drawing specimens. For urinalysis and culture and sensitivity testing, GLSI guidelines recommend that testing within 2 hours of collection is important. Different time limits may apply to specimens required for molecular testing of infectious agents like Neisseria gonorrhea, chlamydia, trichomatis, and so on. For this type of testing, laboratories should ensure that they are able to comply with specimen transportation collections prescribed by the assay procedures. Where compliance with these and also CLSI recommendations is not necessary, that your clinical labs standard information, CLSI, considered should be given to the use of preservative. Specimen collection tubes with preservatives for chemical urinalysis and culture and antibiotics susceptibility are available. So you have to be very careful if you're using a preservative in the bottle. Urine specimen reception in the laboratory. In addition to routine checks and precautions taken for all specimens received in the clinical laboratory, the following additional check items apply to urine specimens. All specimens should be ideally processed within 2 hours and must be kept away from light. That's very important. can be kept in the fridge or about a maximum of 4 hours in an emergency. Labels should be clear and concise and waterproof. Volume should be adequate to run the test. If preservative added, be careful. Collection date and time is important. Collection method is also important. Special preservation not recommended but needed for some 24-hour specimens. Light protection away from light all times. And we have seen specimens kept on a platform with the sun's rays on it, and that specimen is really no good, guys. You've got the containers below. So you can see it over here. Yeah. Let's go to the next slide. So preservation of urine specimens. To delay decomposition of urine, use the following methods of preservation. You can use refrigeration. Preservatives: hydrochloric acid, boric acid, and glacial acetic acid, depending on the test, remember that. Other preservatives used include formaldehyde, toluene, and thymol. The preservatives used must be identified on the label of the container. If no preservative is used, this too should be noted. The note is: before adding a preservative to a urine specimen, contact the laboratory performing the test to find out what preservative to use and the quantity added. Preservatives requirements vary from laboratory to laboratory. List is available what preservative to be used and with which test. That's important. So let's see this sequence of events. So it's a select test, complete order form, receive test order, deploy staff for collection and collection supplies, order the test. Then collect sample, locate patient, collect specimen, transfer specimen to tube for transport and analysis, label specimen, dispose of samples. Transport, prioritize samples for collection, send sample to lab, pneumatic tube, robot, hand carrier, courier. Now here you have to be careful. The bigger hospital labs have these pneumatic tubes where the sample is sealed and put into these tubes, and you give the information outside and the tube automatically arrives in that lab or that place. Essential, apply verify sample label, barcode for testing, rack samples. Prepare sample for testing, centrifuge, aliquot, pre-treat, re-rack, what you don't need. Transport sample to lab section, send sample to appropriate lab section, main lab, reference lab, or wherever it is needed, and again re-rack what is not needed. So just understand the sequence of events from collection to sending the sample to the right lab. So we say examine physical examination of urine and the parameters involved. The physical characteristic of urine include observation and measurement of color, turbidity, odor, specific gravity, pH and volume. Visual observations of urine sample can be important due to evidence of pathology. And here we have a little cross section of the strip that can be used. You can take a look at it. So we start off with the physical examination of urine, right from color, odor, turbidity, specific gravity. pH is, of course, you need your strip for it. So you should learn to connect the physical, the chemical, and the microscopic appearance of the urine. Because if the urine is cloudy and smelly, and you report no proteins, no pus cells, blah blah blah, something is not right, right? The same thing works the other way around. Urine is clear, absolutely clear smell, etc. And you're reporting 40 to 50 pus cells, red cells, blah blah blah. It doesn't connect, right? So that is important, especially for the new tech. Okay, let's go further. So this is a strip, and if you can see it, right, this is what you've been using, and I've given you a three-dimensional view. You've got specific gravity, you've got pH, you've got leukocytes, nitrite, protein, glucose, ketone, urobilinogen, bilirubin, blood, and there you have the compensation path. Alright? So these are, it's loaded onto a special plastic carrier. It's got a nylon mesh, and you can see the pads inside. Alright? So this works on the principle of reflectance. Your chemistries work on the principle of does it work on reflectance? No, it works on liquid chemistry and what your photometer colorimeter picks up. Okay, your urine strips work on the principle of reflectance. So you've got a plastic carrier foil, you've got a diazonium salt impregnated mesh, you can see it on top. You've got absorbent paper in the middle, and you've got iodate impregnated mesh. So this little strip is quite compact, and you can use it. You can have a strip reader. You just insert the strip and it gives you a reading of what you've got, or you can have an automated or semi-automated instrument to read the results. Okay, and over here you can have a completely automated system. You just add the urine in and the system will do the rest. Okay, yeah, these are Roche instruments. Okay, let's go to the next one. So color, start with the first one, physical. The color of normal urine is usually light yellow to amber. Generally, the greater the solute volume, the deeper is the color. The yellow color of urine is due to the presence of a yellow pigment, urochrome. Deviation from normal color can be caused by certain drugs and various vegetables, such as carrots, beets, and rhubarb. Alright, so the color becomes important. The first thing you see is the color, and that will tell you if it's yellow clear, you know things should be alright. But if it's yellow cloudy, then you may get to see many things. Odor. Slightly aromatic, characteristic of freshly voided urine. Urine becomes more ammonia-like upon standing due to bacterial activity. Alright. Turbidity. Normal urine is transparent or clear, becomes cloudy upon standing. Cloudy urine may be evidence of phosphates, urates, mucus, bacteria, epithelial cells, or leukocytes. pH ranges from 4.5 to 8. Average is 6, slightly acidic. High protein diet increase acidity. Vegetarian diets increase alkalinity. Bacterial infections also increase alkalinity, depends on what bacteria is present. Alright. So here you have the urine container which is labeled and you strip it in. Alright, next one. Specific gravity. Now that's important. The specific gravity of urine is measurement of the density of urine, the relative proportions of dissolved solids in relationship to the total volume of the specimen. It reflects how concentrated or dilute urine a sample may be. Water has a specific gravity of 1. Urine will always have a value greater than 1, depending upon the amount of dissolved substances, salts, minerals, etc. Very dilute urine has a low specific gravity value, and very concentrated urine has a very high value. Specific gravity measures the ability of the kidneys to concentrate or dilute urine depending on fluctuating conditions. Now please remember, the most important function of the kidney is concentration. There's one word, concentration. The normal rate is 1.005. to 1.035. The average is 1.010 to 1.025. Okay. So please remember, specific gravity is important. So we continue. The significance of specific gravity. Low specific gravity is associated with conditions like diabetes insipidus, excessive water intake, diuretic use, or chronic renal failure. High specific gravity associated with diabetes mellitus, adrenal abnormalities, or excessive water loss due to vomiting, diarrhea, or kidney inflammation. A specific gravity that never varies is indicative of severe renal failure, 1.010. Okay, stuck there. Specific gravity can be determined by either of the two methods, using a refractometer or a urinometer. Nowadays, a strip also uses a certain principle to measure specific gravity. Another method is by the hanging drop method utilized on the machines. So that's important. Principles of this row strip applied. Nylon mesh ensures uniform color development through uniform penetration of urine. Separate diazonium salt mash improves reagent stability and color differentiation in the leukocyte test. Ascorbic acid protection avoids, now that is a problem and give you a false result. Ascorbic acid protection avoids retesting and prevents false negative results, even with high levels of ascorbic acid. Early detection of potential disease. So we have Roche Combo 10 strips, and these are the parameters, 8 acids, right from pH, nitrite, glucose, urobilinogen, blood, leukocytes, proteins, and ketones. So you have to measure specific gravity, you have the refractometer. The range is 1.010 to 1.022. The test detects the ionic concentration of urine. In the presence of cations, protons are released by complex reagents and produce a color change in the indicator bromothiamyl blue or blue wire blue-green on the strip. The value is monitoring of fluid intake in patients with bladder stones is important. Explains difference between microscopy and test strip results. Leukocytes and erythrocytes may be lysed in low concentrations of urine. Interpretation of borderline results of test strip parameters. Dilution or concentration of urine may confirm or invalidate the pathological significance. Alright? So this little refractometer is important. pH. Course over days, pH is 4.8 to 7.4. Morning urine is about between 5 and 6. The test paper contains indicators methyl red, phenolphthalein, and bromothiamyl blue, and reacts specifically with H ions. The most frequent pH values of fresh urine from healthy subjects is between 5 and 6. And you can see, right, the range from alkaline to neutral to acidic. Leukocytes. In a normal person, usually nil or less than 10 leukocytes per UL are present. Leukocytes in urine are detected by the action of esterase present in the granulocytic leukocytes, which catalyzes the hydrolysis of indoxyl carbonic acid ester to indoxyl. The indoxyl form reacts with the diazonium salt to produce a purple color. The ranges have been given to you. Normal less than 10, borderline 10 to 20, pathological more than 20, practical detention limit 10 to 25 units per UL. Come to nitrite, negative in a normal urine. The test is based on the principle of Ruzbeh method test and is specific for nitrite. The reaction reveals the presence of nitrite and hence indirectly nitrite forming bacteria in the urine by a pink to red coloration of the test patch. Even a slight pink coloration is indicative of significance of bacteriuria. Significance: The presence of nitrite in the urine is one of the most important symptoms of urine, bacteria in the urinary tract. Women are particularly affected by these conditions. Men suffer from these infections increasingly after the age of 60. Recognition and early treatment of urinary tract infection is of a decisive importance. Because a progressive infection may lead to chronic kidney failure, pyelonephritis, atrophic kidneys, and uremia. So this is important. When we come to protein, one of the most important parameters, the detection reaction relies on the so-called protein error of pH indicators. The protein test area contains a buffer mixture and an indicator which changes the color from yellow to green in the presence of protein. Even though the pH is held constant, the particular sensitivity to albumin, an elevated pH up to 9 does not affect the test. The indicator reacts particularly sensitively to albumin. It's treated in the presence of kidney damage. Proteinuria is frequent symptom in renal disease, but is also non-specific. It is not a proof of nephropathy, nor does its absence exclude. What does it exclude? Nephropathy. All right. Okay, let's go to the next one. Come to glucose. The detection of glucose is based on a specific glucose oxidase peroxidase reaction in which D-glucose is oxidized enzymatically by atmospheric oxygen to D-gluconolactone. The hydrogen peroxide formed oxidizes the indicator TMB under peroxidase catalysis to give blue-green dye, which on the yellow test paper causes the color changes to green. So just remember that your test strips do utilize modified methods of your biochemistries. And of course, this is, like I said, it measures by reflectance. So something very similar, what you're using in the lab to detect glucose, this principle is modified on the strip. So your reference range fasting morning urine less than 1.1, and you've got the daytime as well as the diabetic range in the diabetic, all right, more than 30 milligrams. So what is this nylon mesh technology? We asked the question. And why? It has been observed that substances like ascorbic acid, now keep a note, is known to interfere with glucose blood on test strips, giving false negative reactions and a false diagnosis in a patient. To negate this effect, the nylon mesh technology was introduced. Ascorbic acid, vitamin C, inhibits the oxidation reactions of blood and glucose in the test area and can therefore lead to false negative results in the presence of hematuria and glycosuria. The risk of ascorbic acid are false negative reactions and false diagnosis for blood. Glomerulonephritis, pyelonephritis, lithiasis, tumors, glucose, diabetes mellitus, glucosuria caused by kidney damage. So all these come under this purview. Solution to the problem: test strips protection by iodated nylon mesh is so that ascorbic acid is eliminated by oxidation. Iodated components protect blood and glucose detection even when a high level of ascorbic acid up to 750 milligrams is present. The reagent paper and underlining absorbent paper are fixed to the plastic carrier foil by the nylon mesh without the intervention of a glucose component. Plastic carrier foil provides extra strength and absorbent paper layers prevent splashing of the urine. That is where these strips score over the others. All right. I'm coming back to the strip, and this is nylon mesh technology, which is the USP of the Roche strips to prevent external and internal interference. Roche has developed a unique test strip technology using a nylon mesh layer on each strip. The net sealing technology comprises a reagent and underlining absorbent paper which are fixed to a plastic carrier foil by a thin nylon mesh. So you can see how intricate it is. The strip therefore comprises several layers held together without glue, which might interfere with the result. Okay? Please understand. And these are the parameters depending on what strip you're using, which can come through. You've got combo 3 test pH, you've got combo 4, you've got combo 7, you've got combo 9 and combo 10, which assays all the proteins and the biochemistries that may be present, right from glucose to protein, pH, ketones, blood, nitrate, bilirubin, urobilinogen, glucosides, and specific gravity. Fantastic. These are your color changes. I'm sure you remember. Ketones going from white to mauve purple, glucose from yellow to dark green, protein again from light yellow to a dark green, pH from about caramelly yellow to a blue. Interesting. Test principle. The detection of ketones is based on the principle of Legal's test. Acetoacidic acid and acetone react with sodium nitroprusside and glycine in an alkaline medium to give you a violet color complex. The reaction is specific for 2 ketones. So you've got hydroxybutyric acid, does not react, the others will. So reference range is below 0.5 millimoles of acetoacetic acid. Okay. Diagnosis value, indicator of various conditions of diabetic patients called ketoacidosis, which can lead to coma. Detection of starvation states will lead to ketones. Monitoring and detection of diet programs. That's one thing, that if you're on a diet and little ketone appears in your urine, means the diet is working. So monitoring and detection of diet programs will severely restrict intake of carbohydrates, the Atkins diet, and zero diet. Detection of hyperemesis gravidarum, nausea during pregnancy. Fancy name for that. Hyperemesis gravidarum. Okay. Come to urobilinogen. The stable diazonium salt reacts with almost immediately with urobilinogen to give a red azodiol. The test is specific for urobilinogen and not susceptible to interfering factors known to affect the Ehrlich's test. Importance: urobilinogen is excreted in increased amounts in the urine when in the enterohepatic circulation of the bile pigments. The functional capacity of the liver is impaired or overloaded, and when the liver is bypassed. Now this is what you have to see. You and I, we all have a small amount of urobilinogen in our urine. But the moment it exceeds the limit, then chances are that you are going for jaundice and the liver is involved. Alright? Bilirubin reacts with the stable diazonium salt. See, I'm telling you this, all these principles are modified from the chemistries. So, stable diazonium salt, that's your 2,6-dichlorobenzene sorbate, is an acid medium on the test paper. A red-violet azodye is formed, causing color changes to violet. So in all pathological processes that increase the concentration of conjugated bilirubin in plasma, the excretion of bilirubin in urine can reach considerable high levels. Conjugated bilirubin is found in case of increased intracranial pressure due to extrahepatic or intrahepatic obstruction and with periportal inflammation or fibrosis and swelling of necrosis of the liver cells. Now remember this, bilirubin is not present in normal urine, but the bilirubin that is found in urine is because of the high direct bilirubin. And high direct bilirubin is water soluble, remember that. And since it's water soluble, the first body fluid it appears is in urine. If you remember, the doctors in the olden time in their dispensaries asked the patient to avoid urine in a little tube, and then the tube was shaken. If the foam was yellow, doctor said yes, this is definitely jaundice coming through. All right, and of course there are other tests also that they used, but a deep yellow, an amber colored urine is a sign of bilirubin in urine, and this happens because the direct is up and direct is water soluble. All right. Blood. The reference range is 0 to 5 erythrocytes in the microscopy. The peroxidase-like reaction of hemoglobin and myoglobin specifically catalyzes the oxidation of the indicator by means of organic hydroperoxide contained in the test paper to give a blue-green color. High sensitivity is achieved by the addition of an activator to the reagent mixture. Intact erythrocytes are lysed on the test paper and hemoglobin release sets off the color reaction. So again I told you a modification was used in the chemistry lab. Visible green spots are formed. In contrast, hemoglobin dissolved in urine, erythrocyte in lysed form leads to the development of uniform green color. Development of green spots, intact erythrocyte or green color, free hemoglobin in the reagent area within 60 seconds indicates the need for further investigation. And blood is not a nice sign to have in the urine. Then we have the compensation strip, there's nothing there. The white area, which is not impregnated with reagents, allows the instrument compensation for the intrinsic color of the urine while testing leukocytes, nitrite, protein, glucose, ketone bodies, urobilin, bilirubin and erythrocyte. So that is your control area. Okay? And here we go. Like I told you, the first instrument is a handheld urinometer where the strip is introduced and it will give you a reading. Then you've got the semi-automated instrument, and on the right hand side you've got a completely automated instrument where you put the urine and walk off and the urine will do the rest. So this is about urinalysis. Any questions? It's interesting, isn't it? Because we are used to using the strips, and we have a handheld meter where we put the strip in and the strip gives you readings, or you do it visually, and then you've got the good old microscope to connect the physical, chemical and the microscopic. So if your strip is saying there's blood, if your strip is saying the proteins are high, if your strip is saying that the leukocytes are high, you can take a look in the microscopy. And please remember, for a tech, the more microscopy he or she does, the better it is, because you have to connect the three. And everybody doesn't have an automated machine to look into it. Any questions? Nazdeen, Meena, Parul, Rohaina, Parizad. Any questions? No. Nazdeen, clear?
No, ma'am. We are just we need to take care of adding the preservative, correct preservative for correct test. You know, so that is where we need to take little care, because acetic acid will affect microscopy. Formalin will affect the sediment
See,
examination.
usually you put
So
the
mostly we are
preservatives
using
when you're doing giving the patient a container for 24 hours.
24 hours, yeah. So
You know, so
mostly we are using
so not only
concentrated HCl.
yeah, so that is important. Usually for random collections, we do not add
We are not
preservatives
using.
unless the urine is
Yeah,
coming from a very far off place.
yeah. For that also 1 or 2 hours also is okay. It's coming refrigerated to 8 to 10 degrees in the transport box. We are mandatorily we have to maintain 2 to 8 degrees. Sorry, 2 to 8 degrees in the transport box.
Anything new, your side? I hope Parul
There is
and
this iris is there. Iris fully automated urine analyzer. Once you know the urine, one part of it is microscopy, one part of it is chemical analysis. So
little
everybody
louder.
can
Huh? I
read on
can't hear.
iris.
Huh?
Everybody can read on iris. Iris is a urine analyzer. It's a big machine. It's got two parts. One part is microscopy, one part is
The
chemical
biochemistry.
analysis. Yeah, biochemistry. Only thing is, it is little expensive.
Very
The
expensive.
chemicals and all are expensive. So it had a boom around 3 to 4 years back. It was emerging, but now in the markets it has gone down because chemicals and the controls itself are expensive. So now we have semi-automated urine analyzers, not fully automated, where microscopy is manual and the other part, that is the chemical part, is taken up by the machine.
Parul
It's a
and
small unit.
Meena, are you recalling your days where you did urines?
Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes.
Rohaina, you guys do anything in urines? ओ मैडम कुवैत आप कुछ करते हो उधर?
No, ma'am. हम नहीं करते कुछ.
नहीं करते?
I'm actually handling a few labs here. They are doing. So I just had gone to a lab.
Rohan, little louder, huh? I'm still a little deaf in the right ear, huh? A little louder.
I am okay. I said that I go to labs and I help them, because I'm also learning this automated way of doing urine analysis, physical, chemical. So I went to a lab today. I just helped them to calibrate. That's all. So I'm
Okay.
not doing myself, but I'm actually
Okay.
with labs where I'm, kind of good as the application specialist.
Okay.
Okay. Understood. So that is also very important now. There is
Yeah.
more
Yeah.
important than the technician also.
Yeah. If they have a problem, then I tell them, I explain to them, I give them a kind of a lecture because this will help me a lot. This lecture
But
will definitely
can you
help.
differentiate in the microscopy?
We don't know.
That is
I'm not in
important,
touch
huh?
with it.
That is
And they are
important.
not doing microscopy.
No, but I think if you practiced it more, you would. If you practiced it, because see, internationally, pus cell is not going to change, red cell is not going to change, epis are not going to change. But you have to realize, like yesterday from the neural center, the proteins were there, the red cells were there, pus cells were there, and she reported everything. And I was looking at the trichomonas, and this was a lady's sample. So I looked at it again and looked at it again, and I said, "Isn't there something else there?" She said, "No, ma'am, I've reported." I said, "Whatever you report is correct." I said, "But what are these little things moving around, leaf-like organisms?" हाँ, trichomonas है क्या? तो हमको देखो आप.
Yeah,
You
I
know.
have to. I would love to see all that.
You know,
because
you
now
have
here in
to
Kuwait,
be very quick.
hardly. Only in the ministry they are doing this. I don't
Yeah.
think they are doing in the private anymore.
So she said, मैंने देखा नहीं कभी. I said, there, it's right in front of you, it's nice and motile. You know. So, your microscopy becomes very important. In fact, one of my boys who was a trainee, has quit today. Microscopy नहीं है उसको, differential also very poor, microscopy also very poor. But I was very lucky. I've got a student from Jain, first year. First year BSc,
Yes.
and she's a trainee for a week more maybe, and she's picked up beautifully. Differential way as well as pus cell microscopy. I said yesterday, let me check her. I put her under, I gave her a differential, and I tell me, I said, what is this cell? And she picked up the neutrophil, she picked up the lymphocyte, she picked up the monocyte in the eosinophil, which this boy, 4 months with me, could not do it. And that's sad, because we have so many samples, and we made him sit and said, Dekho bhai Sham. See, even right now, Nikat is with me, she'll be going back within half an hour. Hopefully, she'll get a taxi. But we make them sit on the microscopy. In fact, I am a little tense because there's only Aisha is there. Shagufta hasn't come back, and I think she got lots of work. I hope she can do it, and she's managing. She's managing quite well, including the babies that are coming in. So that is very important. Very important. I'm sad that this boy has left, because we can always make use of males in the lab. But he said he didn't want to carry on, so we said, okay, your life. Anything else? Dr. Chogle, anything that you would like to add? And have some water.
Good afternoon. I just want to tell 3 points. One is the 24 hours collection.
Ma'am, just repeat. Ma'am, I'm still deaf in the right ear, so please repeat.
24 hours collection, it should be accurate.
Yes.
Like if they are doing a 24 hours collection, I used to always tell them that the 7 o'clock to next day morning 7 o'clock. The first 7 o'clock sample you void
Yes,
out.
start. You just start.
Then you start with 7, 1 minute past 7, 2 minutes past 7 till the next day morning 7. That makes a 24 hours collection, because you have to multiply by the volume you collected during this 24 hours. So the collection and hours counted should be it should be done properly. First morning sample at 7 o'clock should be voided out, and then it should be collected till the next day morning 7. That is one. Second thing is that many a times these people, rich people, they have maid servants 24/7. So when they keep the container in the bathroom, they should warn their ayabais, or they should warn their servants not to play with that sample, because many a times they may, when the sample collection box is lying in the bathroom, they may throw the preservative, and you may start collecting the sample the next day without the preservative. That is one. Then another point is that the preservative, you should keep a watch, because sometimes what people do, they add water to make the volume. They may be having a very less amount of void. The volume may be less, but many a times I have seen people adding water physically to collecting ground. That should be avoided. So urine actually, I think, is a very good picture of your health. It tells you whether you have proteinuria, it tells you whether you have infection with the help of leukocytes, it tells you whether there is urinary tract infection. If there are a lot of RBCs, it can tell you about the stones, gallbladder stones. It is a very good marker. It is a very picture for your health.